Hi everyone, this is Ken Soltis again. I wanted to talk today about psychological assessment in middle childhood and adolescence. So we'll start off talking a little bit about what's going on developmentally for children in middle childhood. Piaget, who's talking about cognitive development, says that this is the concrete operational stage. So this stage is about age 7 to about 11. The sort of the school age years for the child is moving into adolescence. And here's what Piaget says happens at this time in the child's development. He says reason becomes more important. And so if you've ever worked with very young children, you know that you really can't reason with them. They sort of want what they want no matter what. But as children reach the school age, you can reason with them. You can explain why they should do one thing rather than another. Now, they don't always listen to you, but they're more capable of understanding reason. They start to develop some sort of greater or higher order abilities. Things like reversibility. This is the ability to reverse an action in their mind. Compensation means they can focus on more than one perception at a time. Conservation. This is the ability to see the properties of an object don't change when the appearance of the object is altered. For example, if you have a piece of clay and you have it sort of flattened out and then you roll it up into a ball, a child in this developmental stage, in the concrete operational stage, will understand that that is still clay no matter what its shape is. Younger children may not get that. Seriation is another ability that develops at this age. This is the ability to arrange items according to size. That would obviously start to happen at the younger end of this age range. Similarly, classification children become capable of classification, meaning they can group objects by their characteristics. So we could say, put all of the black objects together, put all of the green objects together, put all the squares together, that sort of thing. Transitivity. This is when children start to be able to understand reciprocal concepts. So they can tell you, if you tell them that A is less than B, they can say, then that means B must be greater than A. Just generally during this time, children have an increased understanding of causality, space, time, and that sort of thing. Now, children at this age are still very concrete, as the name of the stage suggests, so they really don't understand abstract concepts very well yet, but they have an increasing understanding of kind of the physical properties of the world. In terms of psychosocial development, Erickson talks about this stage as this middle childhood stage as a time when the developmental crisis of industry versus inferiority is being worked out. And so by industry, if you're not a native English speaker, that might sound like a funny word. It might sound like we're talking about factories or something like that. In the time that Erickson was writing, that word industry would mean more like productivity, like being industrious, being productive. And so because this is the child, this middle childhood, this would be the school age years, the elementary school age years, or the grammar school years. Here we think about children that are learning to master concepts and mathematics and reading and that sort of thing. They're doing homework. So there's mastery, productivity that are sort of characteristic of that industry. We want them to be industrious and productive. If they do that and they do it well, then they develop a sense of competence. If they're not successful, if they're not doing well in school, if they're not doing well in activities, if they don't sort of have this sense that I'm mastering, I'm being productive, then they can develop a sense of inferiority. In terms of what's going on at this age that might require psychological assessment, there's a number of different things we might want to assess at this age. One would be intelligence. And a lot of times in school-age children, we're looking at intelligence because we want to understand, is this a gifted child? And by gifted, we would usually mean a child that's either above average in terms of intelligence or above average in terms of certain skills, certain academic skills, that sort of thing. The other side of that coin is that we might also be testing intelligence to find out if the child has an intellectual ability or disability, and we'll talk more about that in a second. We also get into learning disabilities. A lot of times early in the school years would be when learning disabilities come out, and so often a psychologist would have to assess that. Some other things we might have to assess: custody, and by that I mean if parents are splitting up or getting divorced, psychologists might be called on to assess the family, to assess the parents and the child, and to try to make a recommendation about which child should have which parent should have custody of the child. There are also a number of mental health diagnoses that that sort of assert themselves during this age, and so we might have to find out things like, does the child have anxiety, depression, attention deficit hyperactivity disorder, that sort of thing. Behavior problems, some children have difficulty behaving appropriately in school or at home. That often would lead to a psychological assessment. And then finally, in cases where there's allegations of child abuse, we often have to, psychologists often have to be involved in assessing children and in trying to figure out what's happening with that and whether the child was abused or not, and if they were abused, who committed the abuse. So I just want to talk a little bit about some of the ways that we assess those various issues. In terms of assessment of intelligence, one of the ways we assess intelligence is the Wechsler Intelligence Scale for children. A lot of times we call this the WISC, W-I-C. The book says that it's in its 4th edition, but it's actually currently in its 5th edition. And the WISC, originally the Wechsler tests were much more, based on this idea of intelligence as a single construct. Remember when we talked about G, intelligence was known as G. Over time, as we sort of come to understand more about intelligence, a lot of the tests that started off historically as single factor tests have become much more multiple factor based. And so the WISC is like that. The Stanford-Binet intelligence test scales also have become more factor based. They're also in their 5th edition, and they can be used with children. Another test of cognitive abilities or intelligence would be the Woodcock-Johnson tests. They're in their 4th edition, and they're also factor-based. They have tests of cognitive abilities, achievement, and oral language. And then there's also the cross-battery assessment, and this approach uses multiple tests of intelligence. So it's a little bit different than the factor-based tests, which have multiple factors within one test. The cross-battery assessment actually uses multiple tests to get a more complete picture of the child's intellectual functioning. Some things we use intelligence testing for, I mentioned earlier, we might be identifying gifted children, and so I don't know how this works in schools and other places, but in the U.S., if a child is identified as gifted, then he or she is entitled to some extra education or some additionally rigorous education. A lot of schools have gifted programs for children, which allows them to do some supplemental work and to receive some supplemental instruction that's designed to challenge them, with the idea that perhaps your normal classes that all the children are in wouldn't be challenging enough for a child who's gifted. And so the idea of these gifted programs would be to give children more educational opportunities than they would get in a normal classroom. A lot of times those gifted programs involve pulling a child out of classes to go to gifted classes. Sometimes there are whole schools set up for kids who are gifted or they might say high achieving academically. Of course, we also use intelligence testing to look at children on the other end of the spectrum and children with what we call an intellectual disability. And when I first started practicing in the early 1990s, mid-1990s, we would refer to these children as mentally retarded. And over time, in English at least, that term mental retardation has come to be seen as very negative, very insulting. And so that term has changed to intellectual disability. For a long time, mental retardation was in the DSM, and that's just what people used. But there's been a really strong movement here in the U.S. to stop using that term because the word retard had become such a insult to people that we really didn't want to sort of keep that in professional jargon. So now we usually talk about intellectual disability or cognitive disabilities, but it all really means the same thing. And these would be children who are below average intellectual functioning. And in early childhood, a lot of times we might have a sense if a child has a developmental delay in terms of their intellectual ability, but we're not always sure that that means that they have an intellectual disability because, again, children develop at just different stages and different rates. And so one child that maybe is showing signs of being a little bit delayed, they might catch up over time. But usually by the time we get into the middle childhood years, the school age years, if a child's still showing a developmental delay at that point, a lot of times we sort of assume that that's going to be fixed for life. And that's when we move into diagnosing an intellectual disability. So with younger children, we're a little hesitant to do that, but as they move into school age years, we really sort of get a sense, if they're still not where they should be in terms of cognitive, intellectual functioning, that's probably going to persist throughout their life. Another thing that we have to that we have to assess would be learning disabilities. And you can understand why we assess these in school-age children and middle childhood, because a lot of times these first manifest themselves when a child goes to school. Now, a lot of people know this. I think you all probably know this. Some children have learning disabilities and be very, very intelligent. So learning disabilities are not the same as an intellectual disability. And sometimes children are just brilliant at math, but they have problems with reading or something like that. There do seem to be a lot of children who are very normally functioning or even high functioning in other areas, but they've got one specific learning disability. I wanted to just give you an idea about some of the different sorts of disabilities that we might diagnose, different learning disabilities. There's a number of them. Auditory processing disorder, or APD, that's a learning disability that affects how sound is processed or interpreted by the brain. Dyscalculia, this would be a mathematical learning disability. Dysgraphia, this is characterized by problems with handwriting, fine motor skills, and in psychological terms, this often manifests itself as disability thinking and writing at the same time. Dyslexia, I think you've all heard about. This is a learning disability that affects reading, and it's also related to language-based processing skills. So this would be it's sort of one of the classic symptoms of somebody with dyslexia is that they get words out of order when they're letters out of order when they're spelling words. Just to give you an example of somebody, when I mentioned earlier that people with learning disabilities can be very, very gifted intellectually, the department chair who hired me for my first professor position years ago, this was in 2003, she earned a PhD from one of the top 10 schools in the country in our field. She was really a bright person, but she had dyslexia. So here was somebody that was teaching in a university, but dealing with dyslexia. So again, it doesn't mean that people are intelligent, but sometimes they have one specific disorder. A few other learning disabilities you might run into. One is language processing disorder. And this is a subtype of auditory processing disorder, but this is a little bit different than sort of the general auditory processing disorders. Language processing disorder leads to difficulty attaching meaning to sound groups that form words, sentences, or stories. And APD affects the interpretation of all sounds coming into the brain, but language processing disorder relates only to the processing of language. But it can affect either expressive language, meaning language that you speak, or receptive language, language that you hear. There's some nonverbal learning disabilities, and these are characterized by significant discrepancy between verbal skills and motor, visual, spatial, and social skills. And these can lead to difficulty interpreting nonverbal cues like facial expressions or body language. There are also visual perceptual and visual motor deficits, and this leads to difficulty understanding information that's seen. So these are just some of the learning disabilities you might run into as a psychologist. In terms of assessing learning disabilities, we usually use some sort of achievement tests. So these would be standardized tests that show where a child rates in terms of national achievement. And so a lot of times if the child's in the 40th percentile, that means that they're equal to or lower than, their achievement would be equal to or lower than 60% of the other children in the U.S. So usually there'd be some sense that, if you get too low on the achievement test, there's some sort of learning disability that needs to be addressed. Some of the achievement tests are used: the Wechsler Individual Achievement Test, the Woodcock-Johnson Achievement Test, and as I mentioned earlier, learning disabilities like these can be found in gifted children as well. Some other issues that we might have to assess for as psychologists, I mentioned earlier custody. When parents are getting divorced or splitting up, a lot of times a psychologist might be called on to determine where should a child go, which parent should the child live with, which parent should have custody. A lot of times we determine this by interviewing parents and children. We may also use projective tests to get a sense of whether a child has a strong sense of anger towards one parent or another, that kind of thing. We do use projective tests with children in this age group. And a lot of times we use those tests to get a sense of traits and tendencies. We may also, in custody cases, we may also test the parents. We may give them psychological tests to kind of determine if they have some sort of pathology that might lead to them not being fit parents. And then a lot of times, at least in the US, the psychologist gives a recommendation to the court as to which parent should have custody. Some other issues that we diagnose or that we need to assess, things like DSM diagnoses. Sometimes at this age, children start to have problems like anxiety, depression, that sort of thing. And when we're diagnosing or assessing those issues, we need to interview the children and the parents. A lot of times we also use some psychological measures or scales, such as the Revised Children's Manifest Anxiety Scale, the Screen for Child Anxiety and Related Emotional Disorders, Children's Depression Rating Scale Revised. Those are just some examples of some of the sorts of scales we might give children to supplement the interviews that we do with them and their parents. We might also see children who have behavioral problems that are brought in for psychological assessment. Again, here we're doing interviews. There are also some behavioral checklists that we might give the children and or their parents. There's the Achenbach's Child Behavior Checklist, the Conners Parent Rating Scales Revised. We mentioned Conners the other time, last time. The Conners rating scales are used for ADHD. These are a little different, but they do have a section about ADHD in them. We may also be called on to assess situations where children have been abused or where we suspect that child abuse has taken place. And again, here we want to interview the child. If the parents aren't accused of being the abusers, we would also need to interview the parents, perhaps. Also, there's usually some collection of physical evidence, which psychologists don't usually need to do, but that becomes part of the issue as well. In the U.S., child welfare workers or caseworkers are often collecting physical evidence. They may need to take pictures of bruises. If a child has been sexually abused, the hospital may need to do what's called a rape kit, where they swab the child for body fluids and that sort of thing by the perpetrator. In terms of what we do as psychologists, besides interviewing the child and their parents, one of the things we often do is we try to find a way to get the children to talk about what happened with the abuse without making them sort of say it verbally. So what we'd often do would be, one approach at least, would be to use a play therapy technique. And so people who do a lot of these sorts of assessments, they may have a dollhouse, and they may have dolls of all different genders and ages. And what they do is they let the children play with these dolls in the dollhouse, and that often is an easier way for the children to tell the story of what's happened in terms of abuse than to sit there and verbally say that to a therapist. And so a lot of times we're using play techniques in assessing child abuse. And we also use play with other types of assessment also with children, but child abuse is one place where that takes place. Okay, so that's a little bit about assessing children in the middle childhood stage. I want to talk a little bit now about assessing children in adolescence. Just wanted to go have a quick overview or a quick review of adolescent development. Piaget says that in adolescent development we get into the formal operational stage, and this is where abstract thought starts to emerge. Now, it's not completely formed at this stage. Even as somebody who's taught university students, it seems to me as though the ability to abstract, to deal with concepts that aren't concrete, but are sort of concepts that are more esoteric or exist more in the mind, that seems to develop even into the early to mid-20s. But people first become capable of operating at that level during this formal operational stage in the early adolescence. This is also where scientific reasoning develops, and this is where we start to see metacognition, and that's just thinking about thinking. So being able to think about sort of being aware of our thought life, our internal thinking, that kind of thing, that seems to emerge during this formal operational stage. In terms of psychosocial development in adolescence, Erickson says that this is the stage where the developmental crisis is identity versus role confusion. And Erickson says that at this stage, young people are working on developing ego identity, which is a sense of who they are, and having integrity between the various aspects of the self. And so sometimes we see children or young people sort of struggling with this. You know, they might be one person when they're around their parents in a church. They might be another person when they're out with their friends. And hopefully over time, they're going to be able to integrate these various parts of their ego so that they have integrity in their identity. A lot of times we see an identity crisis in adolescence, this sort of concern about who am I, what is my life all about. This is also the stage where sometimes we see differentiation from parents. We see adolescents really defining themselves as different than their parents. Sometimes we see very trendy dress or very extreme types of dress. We see extreme haircuts sometimes. And the sense is that one of the reasons for that is that this is a way of differentiating adolescents from their parents and from their parents' generation. And sometimes this goes too far and it becomes rebellion, where we see adolescents getting into things like sexual acting out, like substance abuse, that sort of thing. And those are sort of direct acts of rebellion against the parental authority. Some of the common issues that might lead to adolescents coming into a psychologist for assessment. This is an age where we see a lot of different things possibly emerging. We see eating disorders usually emerging during adolescence, sexual acting out as young people enter puberty. We see that sometimes, and that sometimes, of course, leads to pregnancy. We see issues sometimes with sexual orientation. We see young people that are attracted to the same gender instead of the opposite gender, and that might be a reason they'd come in and seek psychological consultation. Substance abuse often emerges during this period, and in fact, at least in the US, we know that people who end up addicted to substances often start experimenting before adolescence, and they often are heavily into substance abuse by early to mid-adolescence. Suicide is another problem that sometimes occurs, and that occurs often in adolescence. One of the interesting things, suicide is sad, so I don't mean to say interesting in kind of a morbid way, but just something that's important to keep in mind is that older people are actually more successful at suicide, and success isn't a good thing in this case. But a lot of times with young people, suicide, there are certainly young people, adolescents who do end up killing themselves. But there are many times where that attempt to commit suicide is more of a cry for help, and not that it's not serious, not that it shouldn't be taken seriously, but often there's a lot of ambivalence about that. And so what we see is that as people get older, that they often complete a suicide attempt more often than young people would. We often see bullying emerging during adolescence, sometimes in middle childhood as well, but adolescent bullying can be especially bad. And of course, you've all probably seen cases of cyberbullying now, which has become a really big thing. Delinquency, young people who break the law, that often tends to emerge during the teenage years. We often see runaway and homeless youth, and these youth are high risk for all kinds of problems, substance abuse, sexual acting out, suicide, those sorts of things. During this age group, some of these problems seem to be exacerbated by peer influence. The peer group that young people are hanging around with seems to make a difference in some of the problems that they have. Technology also seems to play a role. We've talked about things like cyberbullying. Even in terms of substance abuse, there are websites now where people go on and write about their substance abuse experiences and talk about which drugs are good and how they make you feel. Media and popular culture seem to exacerbate things like sexual acting out, eating disorders, body image issues, that sort of thing. So these issues don't just occur within the person, but they also seem to be influenced by these social and societal trends. In terms of assessing adolescence, psychological assessment of adolescence, again, there might be a need to do intelligence testing with this age group. And one of the things we see is that with younger adolescents, we often would use a scale for children, like the Wechsler Intelligence Scale for Children, the WISC that we talked about last time. As they move into later adolescence, 16 years and older, we often move towards using an adult intelligence scale, like the Wechsler Adult Intelligence Scale. Another way that we use tests would be for university admissions, and I am not going to talk a lot about this because I think that there's a different system in a part of the world that most of you are from, in Europe and Russia. But here in the US, there are a couple standardized tests that are used very heavily in the university admissions process. There's the Scholastic Aptitude Test, or SAT. There's also the American College Test, or the ACT. And in this case, in the US, college is used as a synonym for university. I know that in Europe, college is sort of less rigorous type of degree. It's more of a sort of a lower level of education. Here in the US, we don't make that distinction. So that American college test would be a university admissions test. And the way this works is the higher your score, the better, the more you're seen as kind of a better candidate for doing well in university. We see psychopathology, a lot of types of psychopathology start to emerge in adolescence, and that might be something that we're called on to assess as psychologists. And so a lot of times what we do is we do an interview or diagnostic assessment. A diagnostic assessment would just sort of be like a long psychological interview. A lot of times when I did diagnostic assessments, I had an hour and a half, sometimes even 2 hours to do them. A lot of times we'd be asking open-ended questions based on the person's presenting problems. So a lot of times we'd say to the adolescent, what brings you here today? What are you here to talk about? A lot of times adolescents don't come into an assessment willingly, and so sometimes we have to talk to their parents as well, or the referral source, whoever referred them. But sometimes the adolescent will come in and they'll say, oh, I'm really depressed, and we ask them questions about that. We try to determine how long have they been depressed. Do they meet the diagnostic symptoms for major depression or for dysthymia or some of the other depressive disorders? We just try to get a better understanding of that. We might also use a standardized clinical exam, something like the mental status exam, which has standardized questions that we ask the patients. We might also use some different inventories or questionnaires, and two of the more common ones, I wanted to mention these. One of the more common inventories we might use is the Minnesota Multiphasic Personality Inventory for Adolescents, or the MMPIA. You'll hear more about this in later chapters because there's also just an MMPI, Minnesota Multiphasic Personality Inventory. So this one's specially designed for adolescents. The Milan Adolescent Clinical Inventory is another inventory that's specially designed for adolescents, the MACI, or we call it the MACI sometimes. So the MMPIA and the MACI, these include scales that are related to common issues such as substance abuse, eating disorders, etc. In the MMPIA, some of these scales are supplemental to the main test, but they are there, they're available if you need to use them. And so the other thing that's really nice about the Minnesota Multiphasic Personality Inventory for Adolescents and the MACI, they both cover multiple issues. So when I use these with the adolescents that I worked with, I worked for a number of years at a residential program for delinquent boys who had broken the law. They were teenage boys, and they also had substance abuse issues. And a lot of the boys, when they came in, we'd give them the MACI. And if we were especially concerned about psychopathology with them, we'd also give them the MMPIA. And these two inventories covered so many different areas that they often gave us a really good picture of the client's functioning without having to give individual specific scales. But if we're just interested in one thing like anxiety or depression or self-esteem, there are some specific measures that are specific to issues or diagnoses that we could give. For example, the Beck Anxiety Inventory, the Rosenberg Self-Esteem Scale, the Brown Attention Deficit Disorder Scales for children and adolescents. Those would all be examples of single-issue inventories that we might give to people. I much preferred using the MACI and the MMPIA because they just covered so much more territory. Okay, so that gives you a little bit of an overview of some of the different assessment techniques and approaches that we use when we're assessing children in middle childhood and then as they move into adolescence. As always, don't forget to take the quiz after you've watched this video and read the book. And I hope you all have a good week. I'll talk to you next week. Bye now.